I always felt like I wanted to be a doctor to help people, and then in my journey through medicine, I identified orthopedic surgery as a great way to directly impact patients' lives. The great thing about being a shoulder and elbow specialist is I get to see patients from all backgrounds and all ages. For our younger athletic patients, we see things like shoulder dislocations and shoulder instability. More middle-aged patients, we see things like rotator cuff tears that we can help with. And then for our older patient population, it's common to see things like shoulder arthritis. The exciting thing about being a shoulder and elbow specialist is that new technologies are always being developed. My training allows me to implement really cutting-edge techniques that are fairly new for the treatment of pretty advanced shoulder and elbow conditions. The thing that makes me happy is just getting people back to where they want to be, whether we're dealing with a degenerative condition that's been bothering them for a long time and we can take that bother away and make them feel better again, that's great, or whether it's an acute injury like a broken bone. I take their recovery and rehabilitation very personally and feel like I want to be on the same team with them.